Executive Plastic Surgery. So welcome to another Facebook Live. And so I'm delighted to have a wonderful patient of mine all the way from California. What's interesting is I was there in California just 6 days ago.
Right.
And you were making your trip here, I believe.
I was.
Yes, and so we could have run into each other at LAX.
Right.
So now I learned about you literally 18 days ago.
Right.
For the first time. This is where you called my office 18 days ago for the first time, and you had said that you had what were ruptured implants on an MRI, and so there was like a time sensitivity to it. And I remember Mar told me in the very busy clinic that you have to call California, and there was another patient from Ohio that I had to talk to because there was another surgery that we had to add. I used the word emergently because there was urgency to it. And so I remember calling you, it was late on a Monday, it was around 9 p.m.
That's right.
Yes, so I said you would be the last patient I would call after my clinic. And so now let me ask you this, you are 65.
That's correct.
And you got implants when?
11 years ago.
So 2014.
2014.
So this is your first and only set, what are silicone implants above the
Correct.
muscle from 2014, just 11 years ago. And these were the silicone implants, 270 cc's.
Correct.
Now, you got the implants. Now, you had a MRI done in July, just a few months ago, that shows both of them were intracapsular rupture. That means within the capsule, inside, within, meaning there was no extracapsular rupture. So I want to go ahead and take this chance and say, you do not want to make this intracapsular rupture and extracapsular rupture, because let's say you, God forbid, you're riding your bike or your horse, or you're basically playing basketball and someone elbows you on a basketball court. Or this happened, a patient was riding her bike and another kid came and hit her on the side accidentally because he lost his balance, and now all of a sudden she had pain. Or another kid, that 4-year-old, that mom got on her knees, this is my patient, mom got on her knees and she was gonna hug her 4-year-old, and the 4-year-old came and all of a sudden just accidentally kneed her in the left breast, and all of a sudden she had pain. You don't want to make this intracapsular rupture and extracapsular rupture. And as you saw on the Facebook Live we did a couple of days ago, just 48 hours ago, you do not want to make that paper thin capsule kind of break and now the silicone spills from the inside to the outside. So if you find out that you have a rupture, there's time sensitivity to it, and it's like you have a broken glass that you put glue on and you're holding it together. You don't want to potentially break it, right? So you want to be careful and you want to get this all removed in the end block fashion such that none of the silicone spills. You don't want to be going to the gym and working out and putting undue pressure. You don't want to be getting a mammogram at this time because you don't want to make this intracapsular rupture and extracapsular rupture. So now let me ask you this, why did you get the MRI?
So February, when I did my last mammogram, I noticed the pain was, mammograms are never fun to begin with, but I noticed the pain was excruciating this time. And
which side, right side, left side?
My left side primarily was the most painful side, and at some point, maybe a couple months after that, that was in February, maybe March or so, I thought, this might be time for me to think about getting these out because they're interfering, they're causing me a lot of pain, particularly on one side. I never felt like I could really take a deep breath, which was, and I'm a pretty active person. I play pickleball and I swim and I play tennis, and there's a lot of things that I do throughout the day, throughout my week. And so I got on a consultation with a doctor in California, and it was a virtual consultation, and she said to me, you might want to get an MRI because it looks, based on the you're looking at you visually, one side looks to be larger than the other, and she said that could be a sign that there's something going on there. So, and I never in 11 years was I ever told I needed to do MRIs to really check out the structure of the implants or the integrity of the implants. And so I started trying to get myself an appointment, and it literally took me until July to be able to get the appointment for the MRI. But that did indicate that, as you mentioned, that both implants had a rupture, and over the course of that time, I thought, okay, it's time to really focus on getting this done. But I wasn't feeling any extraordinary pain besides what I had normally been feeling. I was going about my everyday life, and then I had several different consultations. I got involved with some different Facebook groups, and I was trying to listen and look to what other women in the groups had been, who they'd been talking to, and the doctors. And so I made myself a very extensive list, and you were on that list, but I was trying to kind of focus on being more West Coast initially. And through my conversations with doctors, I was told, one in particular, that not to worry about anything, you know, it's intercapsular, so you don't have to modify your lifestyle, just go about, you're safe, there's nothing to worry about, and which is what I was doing. And then come about, well, really a couple weeks or a week before I called your office, I asked this doctor, so you're telling me it's okay for me to continue with my sports and everything? And she said, yes, don't worry about it, you're fine. And so I did that, and then I felt the weekend before I called you, I felt something really drastically change. That had been a really active weekend for me, and I thought, okay, now it's time to get really serious, and that's when I called your office.
Now, what's interesting is, you know, anyone, and with all due respect, you know, I want you to go ahead and see that implant that was removed, or any of those ruptured implants. We do not want the silicone to spill into the chest, and that's the whole essence and gist of what is that end block, right? So that everything is removed as one piece, and it's not only the implant and the capsule, but the inflamed tissue around, because remember, it's ruptured, so it's weeping. And so now I will tell you, either my message that I said earlier is correct, or this other surgeon who said, and I'll tell you, anyone will say that if you have a water balloon, if you will, and it has in it like a rupture, if you will, or you have something in it that you know is going to rupture, you don't want to be moving and juggling it around or pushing it, pressing on it. And I will tell you, common sense will dictate that you do not want to make this rupture an intracapsular rupture to an extracapsular rupture. And this is precisely the reason behind getting the serial MRIs. Mar, if you can please get me that laminated the sheet, and then also the FDA one, the 17 page. So you will see, we do not want to make matters worse, because once it ruptures, it's going to spread more, especially when the integrity of that shell of that silicone implant has been broken. And so clearly that message given by that plastic surgeon is 100% incorrect and wrong. You cannot go about doing your sports and make this what I will say is a no-brainer decision to not, and there's an urgency into getting these out.
Yes.
Now, how many surgeons did you talk to?
I had consultations with probably a dozen.
1 dozen, wow.
But I had, I've talked to many different offices before and just I walked out of a couple consultations, to be honest with you, because I didn't feel comfortable. So
no, just out of curiosity, and please don't mention any names, I just want to say we are very professional. We're trying to kind of understand, and we want to learn from your experience, and I want to help the many patients understand what should be the thought process. Look, there is a big contrast between what the other surgeon was saying and I myself.
Right.
We want to be able to do the very obvious, and we want to do it safe. We want to treat everyone like they're the president of the US, so that they get the best professional service with only one care in mind, that your health is number one and aesthetics as well.
Right.
So what was that turned you off in these other surgeons' offices?
Mainly that one of the first questions that I was asked was, so is this are you wanting to replace these? You wanna just transfer them out and get a new set? And that kind of took me off guard, because I'm thinking not just my age, but also I'm coming here with a significant problem and you're asking me to just exchange one problem for a new set of problems. That was the biggest thing.
Mm-hmm.
And after doing research, I realized that it was important for me to find a doctor who believed in the explant and not be trying to encourage me to do it again. And I think that was, after I did my research, I found out that you were I think you were the only doctor that actually didn't do implants.
Right,
that I
so
had
yes,
on my list.
so I will,
So-
I will tell you, I'm blessed and humbled to say that this is what has been echoed by many other patients who have done a lot of research on me. Believe it or not, I had one of my other patients who was a CIA agent, and she said, I know a lot more about you than you think you do about yourself. And so, and she told me this, you're the only surgeon that has only put in one in his entire career, whereas the other ones, for example, they did a lot and then they chose not to, which is in itself needs to be acknowledged, and that those surgeons need to be credited for making that decision. But I knew early on as a med student that I did not like the results, I'll be honest. I did not like the uncertainty of the implants, and I felt that overall the do no harm, you were violating, I was gonna violate that, even though I would have loved to pay off my medical school loans off, and I would have had a much easier life initially as I started my career.
Right.
But I said, I'm not gonna do something that I genuinely from my heart don't believe in, and I did not wanna make a living out of something that I did not have faith in, or something that I was gonna be happy. I worked so hard, I didn't want to do something that was gonna ultimately harm. Now, one thing I wanna mention here is this, that, we're blessed to see a lot of surgeons who are converting into just explanting. Now, I wanna mention this, and I wanna say this very definitively, because I talk to a lot of surgeons. I have, God knows, over 500 surgeon friends, plastic surgery colleagues that I talk to. I like to interact with them, not only here in the US, but overseas as well, from the Middle East, from South America, from Europe. I know them from the conferences and from the many other questions that they have asked me from my Facebook. There are surgeons, believe it or not, and these are my acquaintance plastic surgeons, they said, can you show me how you do it, why you do it without drains? And I said to them, do you believe in breast implant illness? All the answers that I've heard were, of course not, hell no. I'm just offering this as another aspect of my practice, because why should I not capitalize on explants? Now, this is where that whole ethics, that morality, where you should be only explanting, because that pretty much, I use the word authenticates, certifies, validates you as an explant surgeon. Now, believe it or not, this is a no-brainer, that you have to go to someone who truly believes. Now, believe it or not, there are other surgeons who reached out to me. One wanted to even buy my practice. And he said to me, I will buy your practice because I don't think you're doing a good job marketing yourself. That's exactly what I was told. And then I will run the business aspect for you, and I will market you as just the explant surgeon. And within this umbrella of surgeons, anyone who calls wanting an augmentation, we will divert that patient to that surgeon ABC, and you will be XYZ and those explant surgeons only, so that we can market you better. And I said, how disgusting of a thought. And this is unfortunately what we're dealing with. So within the same practice, the name LLC, or the building, the structure, the group of surgeons should only be explanting only. So if there is a surgeon next door who is just renting space, it's not good enough. You have to have that complete 100% confidence that that entire LLC entity, that surgeon group entirely, not one out of the two, but both of them or three of them or five of them are only explanting. And so this is very important. And I say this very humbly because You do not want to dilute the message. It's all about that trust factor. It's all about that integrity, the professionalism, that there's only one vested interest to doing the surgery correctly. And so you have to do your homework and do your due diligence like you very well did. Now, it takes a lot of effort to come from California. Now, what else was, now during this interaction with the 12 surgeons, how many times did you talk to the surgeon directly?
Maybe about 3 or 4 times.
Yeah, so you want to talk to the surgeon directly yourself, not to the medical assistant or the PA or the office manager, or maybe 3-5 minutes. No, you want to have a sit-down discussion, half an hour. Just this morning alone, I talked to someone for 45 minutes. And you know what? I told her, I congratulate you for talking to me that long. And I told her, this is not the first consultation. We will do round 2, round 3 if you have to. And the point I'm trying to make here is you want to have that confidence in your surgeon so that your surgeon genuinely believes and genuinely is there to take care of you so that you're not second guessing your surgeon. One of the most important things here is you have to have that mental satisfaction, that mental insight, that mental feedback that you have done your homework and processed, and then also equally importantly from your gut that you have made up, your sixth sense has given you that green light that I know what this person is saying and he has nothing but vested interest in my health.
Yeah, I absolutely felt that from our first conversation, to be honest with you. I mean, just the fact that you called me late in an evening, I know your East Coast time, spent at least a good 30 minutes on the phone with me discussing what my situation was and asking me questions, and it just gave me, I really got a sense that you care about your patients, and that was super important to me.
So talk to the surgeon directly, because I find that's key. Now, I will tell you, I myself, I can operate only on so many patients in a week, right? And I'll tell you, my staff is tired. I'm like, usually by Friday, I don't want to use the word burnt out, but I am like tired, but the weekend is the time for me to freshen up. Now, going back to your point now, so you kind of got this, I need to do something about it. I just want to go ahead and mention, this is the mentor advertisement. Look, the moderate high profile over here. It says, quote, MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture. If you look at the FDA's latest recommendations, they tell you get an MRI or an ultrasound at year 5, but they say if there's any questions on the ultrasound, get an MRI. So if you ask me, the MRI is the best test. MRI without contrast, there's no radiation, there is no contrast, and this is the best test to look for what is a rupture. Now remember, the MRI, 4 weeks ago I did a case where the MRI was saying that both of the implants are intact and both of them were ruptured.
Wow.
And in your case, both of them were ruptured, and it was indeed the case. So the MRI is not also 100% correct. There's false positives and false negatives. Now, what was going through your mind as you determined that you were going to get this? Now, you kind of said that you knew that you had to get and act fast. When you and I talked, I said you have to get the medical clearance. Now, I remember, and I want to hear it from you, because I remember when you called me, and I think we talked a couple of days later, you called Mar, and Mar said, Miss, you have another question for me. What was that? What was going through your mind as you were getting the clearance?
Actually, I just wanted, I knew I wanted to do this as quickly as possible. I was so grateful that you made time in your schedule to fit me in during the week when you already had your other surgery scheduled. So I just had to do my part to get the clearance done, and I was running into some complications because I didn't have a primary care physician in California yet. We haven't lived there that long, so I hadn't really got that set up, but I managed to find a way to get it all completed in 2 days span and got that back to you guys. So it just went off.
I remember you called me and you said, Doc, I want to ask you, do you think I will make it there?
Well,
yes.
I was feeling horrible, and I didn't know. I asked you the question, do people ever not actually make it to their surgeries. I was worried I wasn't gonna survive the trip.
How sick were you? Like, what made you say that?
I, you know, I can't really put it into words what happened, but um, I just knew something was terribly wrong, and I never felt like that in my life. So I was just worried that I wasn't gonna be able to make it to the surgery date. That's how I felt.
Mhm. Now, I've
So-
been told this by many other patients who have said exactly the same thing. Do people make it? And I said, unfortunately, I have had patients come to me on a wheelchair because they couldn't walk. That's how ill they have gotten. And believe it or not, that same patient that came on a wheelchair from New York, she ended up walking into my clinic, and I was very much surprised that she did make the walk. And if you see her before after pictures, you will see the inflammation that subsided. Remember, the hallmark feature of breast implant illness are the joint pains, neck and back pain problems. And this is where you kind of feel the doom, the feeling that you're dying. That's one of the checked off boxes. Now, let me ask you this. What symptoms of breast implant illness did you have, if any? Because you knew the rupture was there. So that kind of started it, if you will. But did you have any symptoms of breast implant illness?
When I actually saw the list, because honestly, I've been experiencing things for probably the last 4 or 5 years, and I didn't connect the dots. I didn't know what breast implant illness was. And then when I actually saw the list, I probably had half of everything that was listed on that 30. Like I've been to the hospital a couple times feeling like I was having a heart attack. And because of this pain that radiated and not being able to breathe and high blood pressure.
When did you go to the hospital?
I was as recently as June.
June, okay.
Mhm.
Like when you walked
I've been
in
there 3 times.
3 times, what were your chief complaints?
I was having chest pain that radiated into my back, shortness of breath, and that was basically it. I mean, I've heard before that women have different symptoms than men for heart attacks. I'm like, is that what I'm experiencing? And each time I went, they hooked me up to electrocardiogram, and they said, nope, you're not having a heart attack. And they've done CT scans, and they've said everything looks fine. They sent me to a cardiologist, and they did this calcification test. They said, you don't have any calcification, there's no problem. I had digestive issues, I've had joint pains, I mean, you name it.
Right, the same thing. And this is where, remember, the palpitations, chest pain. I remember when I was marking you on the left side, just for me to mark you in the crease, you had pain, and I was afraid that now that intracapsular rupture would have become extracapsular. Now, what were you feeling like right before your surgery? Because I remember talking to you.
I was nervous because nobody wants to go through surgery, right? It's not a fun thing to think about, but I remember when I went skydiving 10 years ago, and I was nervous to go up skydiving, but when I watched the people come down off the plane in front of me, I thought, okay, it's gonna be okay. And as I was sitting upstairs, I saw a couple people come out of surgery, and I thought, they look okay. So I said, I think I can do this. That's all I told myself. But it's not something you plan when you get implants in. You don't plan the explant, right? You don't think about what that's gonna be.
Right.
So I was just fortunate. You have a fabulous staff here. Your anesthesiologist was wonderful. I mean, the whole thing was just seamless.
No, thank you. Now, we just want to mention the black box warning. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. And what is interesting about your case is these are supposed to be the nicer, better, safer gummy bear implants from just 11 years ago, 2014. And God knows you might have been ruptured from like 6 months ago, or maybe from February when you had your mammogram. Maybe last year, we do not know, and maybe the mammogram that as you got, the test that might have been what gave you the trouble that precipitated that visit to the to the plastic surgeon who ultimately ended up getting you the MRI. How was your anesthesia experience?
Oh, it was, you know, probably, I haven't had anesthesia too many times in my life, but it was simple.
Mhm.
The whole process was simple. I remember waking up and thinking, I just had surgery. I didn't even think I had gone through surgery when they were waking
So
me up.
this is the twilight deep sedation. You have no recollection to date. Not a single patient has had any recollection of the surgery. And the patients are completely amnestic. We do not paralyze our patients. Everyone gets the heparin subQ shot. You're literally breathing through the surgery, as you saw in the video that I showed you. And overall, a very practical, efficient surgery. And I will tell you, we're very blessed to have Dr. Alex Alamar, who, by the way, will be a guest with us in the next few weeks. If you have any questions, please get them ready for Dr. Alamar. And he is A+ outstanding, just like our CRNA Aradwa. She's been with us for almost 5 years. And we're blessed to have a great team, including Mar and Natalie. And we have only one interest to make your experience like the best experience. And I just want to say that, I appreciate you coming forth and discussing. I remember you said, I want to fix my hair. I said, I will fix my hair too, if that's what it takes. We would just want to share our journey. What was your post-op pain like? Because you're just 2 days out from your surgery. And I want each and everyone, please go to the Facebook, YouTube live from a couple of days ago, and you will see exactly the end block, the gold standard. Blood loss was literally 5 cc's, a lot of big inflammation going around. All the inflamed tissue was removed. A lot of extensive contouring on the breast tissue, such that you got what was that true classic pseudo lift, the Khan Dakai pseudo lift. So very important. How's your pain post-op now, 48 hours after the surgery?
So far, I think I've taken 6 extra strength Tylenol.
Yeah, 6 extra strength Tylenol. Now this is where you did not get the Exparel.
I did not.
Yeah, and I will tell you, this is how most of the patients are, even before the Exparel. They have done relatively well. Exparel kind of gives you that peace of mind, confidence that you're going to be, relatively, I use the well when it comes to the post-op pain. Now, I just want to go ahead and, so this is something that I want to show, and again, not my words, these are the words. Breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff, issued September 29. You can Google this. So on this page 14, now let me ask you this question before, in January of this year, before your mammogram, did you have any symptoms, pain, or anything like that?
I've had left breast pain for years.
Already? Okay.
Yeah, several years I've been feeling it, and I've talked to my doctors about it in where I moved from, and but nothing's come of it. Nobody told me to do an MRI, so I don't know. Maybe it's been ruptured for a while.
Right. We do not know. So these are not my words, and I'm going to read page 14 at the very top. Quote, I understand that silicone can migrate from my implant into nearby tissues, for example, chest wall, lymph nodes under the arm, and organs, liver, lungs, where it may not be possible to remove. I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Mammography can also cause the breast implant to rupture or leak. I should tell the mammography technician if I have breast implants. So the point here is they're telling you, they're acknowledging. Yesterday I did an interview. This was a interview that we're going to publish. This was a gentleman who very knowledgeable, who read up on me, did a lot of research on breast implant illness, and he did an 1.5 hour long interview on everything about me. He asked me whatever question and I answered. So you will see that's a very in-depth topic. This is Mr. Christian Elliott, who has his own podcast. He told me, and this is true, sometimes when you're positioning getting mammograms, you can apply 10, 15 pounds of force as you're getting it, up to 20, 30. And so the point I'm trying to make is this is not a pleasant experience to get a mammogram to begin with, minus implants, and especially if you have a capsular contracture or pain and you're getting it, you can only imagine how uncomfortable of an experience it can be. And unfortunately, I've talked to a small subset of patients who said they did not want to get ever another mammogram because they did not want to go through the pain of getting the mammogram. And I'll tell you, the pain of detecting cancer later on because of a missed mammogram, because millions of patients have had early detection of breast cancer from mammograms, you will see that that is much worse than having to go through the pain of the mammogram. And if you ask me, 1 out of 8 or 9 women are going to get breast cancer, and because the mammogram interferes with, because the implants interfere with a good mammogram and certainly a good self-monthly breast exam, that in itself alone should be a reason to not get an implant, because you don't want to miss breast cancer, right? I will have you, I think we touched on a lot of points. Anything you want to bring to anyone's attention who is listening?
Mostly just that if you have questions and if you're seriously thinking about it, don't wait, because I wouldn't want somebody to go through that fear that I felt like, those last few weeks. Basically, that's it.
Right. No, I will tell you, the first and foremost thing is, I tell the world, don't listen to me. Listen to the patients. Listen to what we already know in these publications. These were not written by small medical students. These are established documentations by the manufacturers and the FDA recommendations. These are hard facts about implants that one needs to know and must know. Many patients that I've talked to, unfortunately, do not know that they're, they thought they were lifetime devices, and they certainly are not. On average, 10 years plus minus. If you look at the rate of rupture, if you look at the studies that have been done on Mentor and Allergan, they study up to 10 years, 11 years. After that, there is no more studies because the rate of rupture goes up significantly. That alone in itself, it's kind of misguiding patients. You do not want to wait and get an MRI and show a rupture, and now you are dealing with a bigger fire than, let's say, had it not been ruptured. I remember a case that I did several months ago. This was a nice patient from Ann Arbor, and she came in to my clinic and she said, I have no complaints of breast implant, which absolutely happens. And she said that I want to get him out because I heard you say it's the 10-year mark. And the last 10 years, and she's like, I'm old, I'm wise, and I just don't want them inside me. And lo and behold, her exam was unremarkable. I remember going into her case, and lo and behold, she had a ruptured right breast implant.
Wow.
And so this is where just the fact that she said that she had reached the 10-year mark, and remember, majority of this is what they call silent rupture, which means if you examine the patient, exam is A+, it's very good result, and lo and behold, I've gone in and found out what was a ruptured implant. So you never know. We have a nice, wonderful patient of mine. She is 81 years of age. In November, the second week, she's going to come on as a guest for our Facebook Live. And she had an implant from 2021, just 4-year-old set of implants, and the right one was ruptured in 4 years alone. And the point I'm trying to make here is there is nothing gummy about that implant anymore. And the bottom line here is one who gets implants and wants implants, they need to educate themselves about what are the implications. And this is part of the informed consent. So it should not come as a surprise as what I'm reading. And those patients who are hurting, they need to know that there are results and there are answers that are available. I will end with this one paragraph that is that third line on that black box warning, and then I'll let you finish.
Okay.
This is the black box warning, and that very well established. Patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. So I'm gonna stop here. This in itself is telling you BI exists. So there was another group of surgeons that I got out there and say, oh, look, BI exists. I said, no, we knew this all along when the implants were banned in 1992 because it's the same hurt. So BI absolutely exists because we know it does. Individual patient risk, quote, individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Quote unquote, complete resolution of symptoms means cure, and meaning they have cure of their symptoms. So if you're going through the hurt and you're going through the misery, then you know that these are the implants. This one patient that I talked to for 45 minutes this morning, I asked her, and she's this nice young lady in her 30s, and I asked her, what % chance do you think you have breast implant illness? And she said 99.99%. I said, you might as well add that 0.01% and make it 100, because what else would be accounting for all of this? And this is, yes, we don't have a lab diagnosis or imaging diagnosis, but we know so much about it's a diagnosis of exclusion. No one has walked into my clinic and said, oh, my implants are making me think better, sharper, I can jump higher. I performed so well because I was thinking, meditating well, I didn't have headaches, or my vision was improved, or my neck, back pain was better. If anything, the implants only cause hurt and harm. And my message to anyone, if you're thinking about getting implants, please know what you're signing up for. If you have implants and you're hurting, please know there's a reason or reasons why you might be. And if you're looking for answers for good, better health, certainly join the Facebook group page and listen to the many patients who are hurting and who are seeking relief, and that who are only benefiting and getting a better state of health. There's two things that almost all my patients have said, if not all. They wish they had never gotten implants. They wish they had removed them sooner. And I'll let you finish, please.
I concur exactly with you. In hindsight now, I wish I had done more research before I even got them. I didn't even think down the road. I'm still surprised that both my implants could have both ruptured with being only less than 11 years old, and just so happy I made the decision to do this now, because I'm ready to move on and get my life back.
Right. So, I just want to mention one thing that is important. You hear now a group of plastic surgeons who are out there on TikTok, social media, Instagram, and they're holding the Motiva implant, and they're like the safest thing that man has created. Horrible misinformation, wrong information. These are the microtextured. They're just saying that this cigarette does not cause cancer. And I will tell you, that is the exact message they're giving. Remember, these implants, the microtextured, they have the inflammation. They're still the silicone, right? This is the same wrong misinformation. It's not like you're getting your teeth clean, or you're getting, it is a real deal. And you need to know what are the implications of getting implants. Implants from the 80s, 90s, implants from the 2011, implants from 2025, they're all in this big pot of what is misery and badness. And I will tell you, that implant is not a lifetime device. I challenge them, for any of the plastic surgeons, to say this. They will disintegrate, they will leach out silicone. This plastic surgeon mentioned they are not as inflammatory as, how can you guarantee to this patient that it's not gonna rupture or it's not gonna cause inflammation? So again, there's a lot of misinformation, and unfortunately, you need to do your homework as a patient. You need to be your own advocate, and you need to do the research on your own before you know what you're signing up for. Well, thank you.
Yeah, thank you.
All right, thank you. Please get any questions ready. You can go ahead and finish more. For us, we will do another Facebook Live next week, and I thank you so much for coming forth and sharing your journey. There are many patients who will relate to you.
Oh.